Thank you, Dr. Nahad, for good defense for drug-coated balloon, but Dr. Ahmed Balbola against you.
Good evening, Mr. Chairman, ladies and gentlemen. Drug-coated balloon angioplasty has no justifiable evidence-based indication in tibial vessel occlusion, and I have based my conclusion on studies about safety, efficacy, and cost-effectiveness of drug-coated balloon when used in tibial vessel disease. Proponents for the use of drug-coated balloons in tibial vessel claim that it's safe, adding no harm to the patient. It's effective in terms of reducing the incidence of recurrent stenosis or occlusion, so its incremental increased cost is justifiable. Not all that glitters is gold. In 2016, a meta-analysis of 5 randomized controlled trials investigating the effect of drug-coated balloons versus plain balloons in treatment of patients with critical limb ischemia and tibial vessel disease, it was found that the use of drug-coated balloons was associated with a significant reduction in late lumen loss. Thus, it does result in a more durable repair. This was supported by another more recent meta-analysis in 2022 that showed that treating infrapopliteal arterial disease with drug-coated balloon has lower incidence of restenosis and was associated with significant reduction in clinically driven target lesion revascularization. But the devil is in the details. If we look into details of the meta-analysis in 2016, we can find that there is no significant difference for the risk of target lesion revascularization between the use of drug-coated balloon versus the use of plain balloons when treating patients with critical limb ischemia. Our main goal in treating patients with critical limb ischemia and infrapopliteal disease is healing wounds, healing foot wounds, and prevention of amputation. And again, if we look into details, we can see that the use of drug-coated balloons, when compared to plain balloon angioplasty, did not result in reduction of either minor foot amputation or even major limb amputation. And this was supported by the more recent 2022 meta-analysis that showed there is no significant difference with regard to major target limb amputation between treating patients with infrapopliteal disease with either plain balloons or drug-coated balloons. Here we can see also that there is that the use of drug-coated balloon did not result in reduction of the rates of incomplete wound healing in patients with critical limb ischemia. If you look into individual studies, we can see that the IMPACT DEEP trial, which was a randomized multicentric controlled trial for the investigation of safety and efficacy of drug-coated balloon, we can see that the use of drug-coated balloon at 12 months resulted in a significant increase in the rates of major amputation. It's almost 9% versus 3.5% in patients treated with plain balloons. The 5-year results of the same patient cohort in the IMPACT DEEP study, the results showed that there is no significant difference in the outcome between patients treated with plain balloons versus patients treated with drug-coated balloons. An unanswered question is, does the positive remodeling and prevention of restenosis result from the use of drug-coated balloon, or it is the effect of aggressive medical therapy? Another issue is about the safety of drug-coated balloon. It was found in a meta-analysis of 8 randomized controlled trials, totaling more than 3,000 people treated with drug-coated balloon versus people treated with plain balloons, with over 350 mortalities. it showed that there is an increased relative mortality risk of 38%. That accounts for an absolute increase in mortality rates of 4.6% with the use of drug-coated balloons. Another issue is the risk for paclitaxel embolization. We know that the drug-coated balloons has a concentration of 8 times greater than it in the drug-eluting stents, and more than 50% of the drug might travel distally, causing distal embolization. In an experimental study of 25 rabbits, and after ligation of the left common iliac artery and inflating a drug-coated balloon in the lower aorta for 3 minutes, and then sacrificing the animal 2 hours later, they found by histological analysis that all the muscle tissue samples had embolized paclitaxel crystals. This was supported by another experimental study in a swine model that showed that sections of skeletal muscles downstream from the treated arteries show arteriolar changes of fibrinoid necrosis consistent with paclitaxel embolization. What about cost effectiveness? This is a prospective randomized controlled trial that was conducted to investigate the cost effectiveness of the usage of drug-coated balloons versus conventional non-coated balloons in the treatment of chronic limb-threatening ischemia in patients with infrapopliteal disease. And they found that when compared to patients treated by plain balloons, patients treated by drug-coated balloons gained an average quality-adjusted life years of only 0.012 at a higher cost that accounted for $1,854 per case. This translates into an incremental cost-effectiveness ratio of $154,500 additional American dollars per quality-adjusted life year. So, Mr. Chairman, ladies and gentlemen, are we really enthusiastic to pay extra money for a procedure that did not prove to be safe and effective? Better the devil you know than the angel you don't.
Conclusion, please, Dr. Ahmed.
Thank you.
For saving time.